Now back to one of our top stories. While water samples from the Vaal River in the Free State have detected cholera, one person has died in that province due to the waterborne disease. Let's bring in the spokesperson for the Health Department in the Free State, Mondli Mvambi. Thank you so much for your time, Mondli. We do appreciate it. Maybe just tell us what the situation is in the Free State when it comes to the cholera outbreak. Here in Gauteng, it is rather dire, and there are many concerns that the results from the Vaal River have tested positive for cholera. What is it looking like in our hospitals in the Free State?
Good evening, Heidi, and good evening to your viewers. The situation of cholera in the Free State is as equally serious as anywhere because one cholera death is one too many. At this day and age, we do not expect to be having cases of cholera. We have up to now seen a cumulative number of about 153 people in our health facilities in the Free State, in the place Vredefort and Parys, which are on the border with Gauteng and Northwest, basically. Now, the number of cases confirmed, cholera laboratory confirmed cases, is 9 in the Free State. Unfortunately, one person has demised, 33-year-old female from Vredefort, and 8 cases, 2 from Parys, and I think it's 6 from, it's actually 7 from Vredefort. They are, the 8 are still alive at this point in time. So the recent developments are that since yesterday, we are seeing about 15 new diarrhea cases as of 26 of May, with 9 in Vredefort and 6 in Parys. So it is still restricted to that part of the world. However, last week Sunday, upon looking at the increasing numbers of cholera cases in the country, the MEC of Health convened a multi-sectoral team, which comprises of the water department and the municipality, CDC, the WHO, Department of Health, Mwate Municipality, and Fezile District Municipality. All those teams, he convened them because, in fact, spreading throughout the province as well. Because as we say, ours is a precarious situation as the Free State. We're at the heart of the country, surrounded by 6 other provinces and the Kingdom of Lesotho. We've got 5 national key roads passing through the Free State. So we're susceptible to anything that is happening around the country. So there was that need for us to activate outbreak response teams in all the 5 districts of the Free State, whilst we are dealing with the situation in Mwate, but to keep on the alert in the other parts of the district, so that any cases of increase or detection of any cases of either diarrhea or cholera, the province is able to respond quickly to those, so that we avert any potential loss of life or people getting seriously sick. But we empower them with education at this point in time, so that they know what to do upon encountering any signs or symptoms of cholera.
Okay, can I ask you, Mondli, how many people are, if any, are in critical condition?
Well, there's one 10-year-old right now who's admitted in the Parys hospital, who's under surveillance at this point in time. The swabs have been taken from that patient and sent to the laboratory for confirmation. So that patient is under care at the moment in the hospital. Many other people that have come in, they've been seen in the facilities, and many of them have been quickly treated back home. So out of the 153 people that we've seen so far, we've got this one 10-year-old who's now in Parys Hospital.
Okay, Mondli, are you advising the community in and around that area not to drink the water until the situation calms down?
Well, we can't advise people not to drink the water. We are advising people to treat the water and to treat the water just to empower them. Because you've got boreholes there. At some point, some water was treated, and the samples came negative in some of the water sources that are there. 3 water sources that we have identified. One, the boreholes that are there, tap water, and the third one now. The third one is escaping me now. But what we are advising people in all cholera related situations, we are advising people to treat the water, to sift it, to boil it, to apply a limited amount of bleach, for instance, to treat the water, so that they can be able to drink and continue living. It's treatable. It's a universal accepted norm, that one of how to treat water in such situations. So we are equipping them with that kind of information. We have trained our community healthcare workers and other health cadres in the area to be able to go into that community to increase health education through health promotion, just to make sure that everybody knows what to do in treating the water, but also what to do should they feel any symptoms such as nausea, vomiting, diarrhea, for instance. They need to be able to place people on oral rehydration solutions whilst they are taking those people to the nearest level of care, so that people can be suffering from cholera or what next of level of medical care can be given to those people.
Okay, thank you so much for your time this evening. We do appreciate it. That was the spokesperson for the Free State Health Department, Mondli Mvambi. And I just want to highlight the fact that it's a very difficult situation to tell people to treat the water. The water should be safe and clean coming out of your taps. If you are lucky enough to have fresh and clean water coming out of your taps, not to tell people to treat the water, and then there's cholera.